You can do that?
Yeah.
I'm trying to whisper.
It's all right. It's all right. Now, posterior glide. One way of doing it, the patient is going to be sitting, right? People say this doesn't look like good body mechanics. Yes, it doesn't look like it, but if you're like with your knee straight and you do distraction, of course that's bad for your back. Lunge position, neutral pelvis. And what I'm going to do right here is maybe do a little bit of distraction and posterior glide. You ready?
Yeah.
Distraction and posterior glide. You see my arm? I'm not here. Yeah, you can do it, that's fine. But you see, if my elbow is bent, you see the line of my forearm? The forearm is going to go like that. I want my force to go posterior to her knee. Boom, right there. And I'm putting my weight on it. So I'm saving a lot of energy and she's going to feel better. Okay, distraction. And you can do oscillations, like 1, 2, 3, and 4. So that's one way of doing posterior distraction. Okay, the other way. Go ahead and lie down on your back this time. If you have a high and low table, please use it. There are some clinics that you don't have that luxury because some therapists don't like this. But if you do have a high and low table, use it. Now, I'm going to sit on her foot.
Okay.
But I'm not going to hurt her foot. I'm going to try to, maybe this time it could be a little bit more than 25 degrees of flexion. Right? My thumbs are going to locate the tibial plateau. And I'm going to perform a posterior glide. Now, people will say, well, this should be better. You think so? Maybe yes, because you're locking your elbows. You can put your weight on it. But let's say if you're a little, your arms are a little bit longer than normal. What I do is just bend my elbows and just put my weight on it to do a posterior glide. In this case, the distraction, I'm not doing any distraction, but once I'm flexing the knee, you see close back position is full extension. If I bend the knee, the two surfaces are going to be a little bit apart. So flexion is going to give me a little bit of a natural distraction. You don't want to do this with full knee extension for sure. Now, locate tibial plateau. If you're touching the patella of your thumbs, that's too high. And then posterior glide.